Hi, this is Five Questions with an ISHLT member, and I am Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation. And today I am excited to be interviewing Fernanda Silveira from the ISHLT's Infectious Diseases Professional Community. Good morning, Fernanda.
Good morning, Jess. Thank you
Uh,
for having me.
well, thank you for being here. Before we dive into our five questions, do you mind sharing just who you are, what you do every day, and what your role is with ISHLT?
Sure. So I'm Fernanda Silveira. I'm a transplant infectious diseases physician here in Pittsburgh, Pennsylvania, at the University of Pittsburgh Medical Center. And I do a few different things here. I take care of patients, I do clinical research, and I'm the director of clinical operations for our group. And my current role at ISHLT is that I am the representative to the Leadership Advisory Forum for the Infectious Diseases professional community.
Well, it's great to have you in that role. What got you involved in ISHLT originally, and what keeps you here?
So I've been involved with ISHLT for a really long time. It started when I was a very early as a junior faculty. One of my mentors, Shahid Hussein, was the one who introduced me to ISHLT and told me a lot about the society and encouraged me to join and to go to my first meeting. And when I did, I got hooked. It was really nice because I I felt extremely welcomed when I went to my first meeting. Not you go, you learn a lot. The scientific content was great, but it was very impressive to see how, despite being very junior and being there for my first meeting, how all these important people would come and talk to me and just make me feel a part of the society. And I've always been given lots of opportunities to participate in different projects of the society and feel that I belong. And I think that it's a very special thing that ISHLT has.
Well, I love to hear it, and I love that your story includes a little bit of the breaking down of those hierarchies. I think that's really lovely. That somebody brought you in and made you feel right at home. Tell me a little bit about your career path. How did you get involved in infectious disease? What's your connection to the transplantation side of it? How did you get there?
Mhm. Yeah, so I think that started a little bit in medical school. Wasn't anything that I planned, but I think very early in medical school, I realized that I didn't want to be tied to a single organ system and that I liked more to take care of patients in the hospital rather than outpatient.
Mhm.
And I had several experiences that led me to infectious diseases. One was a very good infectious disease course in medical school. I was very lucky that I had a research mentor in medical school, and his work was and still is in infectious in immunocompromised hosts. The focus was in is in patients with hematologic malignancies. So that already got me thinking about patients with immunocompromised patients.
Mhm.
And then I did my medical school in Brazil, and I had the opportunity to come as a medical student and and visit the Mayo Clinic, and that was my really first exposure to transplant.
Mhm.
And I thought it was completely fascinating, um, the transplant world, that what you can do to patients with end stage organ disease and give them a new opportunity. And based on all of these opportunities that I had and different experiences, I decided at that point that that's what I wanted to do. I wanted to do infectious diseases and I wanted to pursue a career in transplant infectious diseases. And after that, I came to do the remainder of my training in the United States, and was fortunate that I was able to do my fellowship training in Pittsburgh and continue my exposure to transplant here, and just have been very lucky to work with several people who have given me even more opportunities in the field. And and one of the things that I really like is the multidisciplinary uh, nature of
Mhm.
transplantation.
Absolutely. It's one of my favorite parts too, just seeing how all the different communities come together. And I love how many
Mm.
stories, I mean, how many different centers and people are in your story. I think that's really nice.
Yes. Hmm.
Um, so tell me about a meaningful milestone, either something in your career that you've achieved that you're proud of, or something in the field that just feels really momentous to you.
In the field, I think that um, thinking more about heart and lung transplantation, I think there are a couple of things that I think are very important. Um, all the support that we are able to give to our patients now with ECMO, I think it has really changed our field in the last several years. But talking more in terms of infectious diseases, the availability of the direct antivirals to treat hepatitis C, and that have given us the opportunity to use hepatitis C um, organs uh, for recipients who do not have hepatitis C. I think that has been pretty exciting for us.
Yeah, that's amazing. Big breakthroughs there.
Yes.
When you think about the future, so that's a recent breakthrough, but when you think about the future of transplant ID and specifically heart and lung, but even or in general, what do you see on the horizon?
I think we have a lot of work to do, and I think we'll be having a lot of new things coming up in terms of immunomodulation.
Mm,
In the last few years, some improvement. We saw already some improvements with vaccines, right? With the
mm.
mRNA vaccines for COVID, and I think we'll be seeing more improvements with vaccines coming up in the future. And I think we're starting to see more work with cell therapies that are going to be helpful for us to manage, especially severe viral infections that are still a major problem for our transplant recipients.
Absolutely. So when you're not in research or in clinic, what are
Mhm.
you up to? What's your idea of a perfect weekend?
Perfect weekend. I love warm weather, so any weekend when it's warm and there is sunshine and
Yeah.
I'm with my husband, my kids, and friends, that makes it perfect.
Yeah.
If I can be close to the ocean, difficult here in Pittsburgh,
Yep.
but if I can make that happen when we are on vacation, that makes it even better.
Yeah, it's
But
just
but
six
just
hours away.
yeah, but just being, outside uh with sunshine, that makes it, and with your family and friends, that makes it perfect.
Absolutely. Yeah, I know. Moving to a place like Pittsburgh with a cloud layer after Brazil has to be a little bit of a challenge.
It was I had to adapt, but I've I've been very fortunate to be here. This has been a very good place for me.
Absolutely. Well, Fernanda, thank you for taking some time to chat with me today. Is there anything else you want to share with the ISHLT community we haven't talked about yet today?
Yeah, thank you for having me. I have to say that ISHLT has been a great community to be a part of. I think it is a place where we really feel like home. Uh, we make very good friends, and truly, it's a society that really has embraced um, the idea that you know we are we are all in this together, and to make the best for for our patients, and a society that really has been truly concerned about making sure that there is diversity across, geography, gender, hierarchy, and it's not just um, by talking; it's by doing it. So I've been very proud to be a part of this society, and I look forward to seeing all of my friends from the society at the next meeting in Denver.
Well, I couldn't have said it better myself. Thanks so much, and I'll see you next April in Denver.
Yes, I'll see you.